Hi, thank you so much for coming back, and we're talking about nutrition. I'm talking here with our H-E-B dietitian, Lorena, and we'll go ahead and just talk a little bit more about nutrition. Talking about servings, we were talking about protein, and I do talk about important sources of protein, and I talk about the importance of fish so much in my counseling, especially for the teenagers, because I'm often checking their cholesterol at their visits, and so many of them have low HDL, and I'm like, you need those omega-3 fatty acids. But if you could just kind of go over the important sources of protein and then what you kind of recommend for that.
Absolutely. So every meal, every snack should have some form of protein, whether it be in a meat source, nuts, even whole grains, they're going to have some form of protein too. So that's really important because as you look at getting full and satiated, protein plays a role in that. Again, what I see a lot of families and kiddos do is get full on the carbohydrate, right? So we want the 3 waffles with the syrup and then the juice, right? So that is what's filling to us. So the protein plays a huge role in that. Not to mention, protein is very important, actually plays the role of creating hormones.
Yes.
And that is something we don't talk about because we always talk about just it being something that we use for our muscles. But it is so important to get your essential amount of protein meal to meal because of that reason, because of the formation of hormones. And so if you are lacking in any amount of protein at any given meal, you're turning over your muscle and getting that breaking down, but you're also not creating the hormones that you need in your body too. So I like to talk to that a lot. But when it comes to fish, now I love that you mentioned that, Dr. Maupin, because within this culture, fish for us is, during Lent, on Fridays. And people are so intimidated to cook it.
Right.
And so, this is one of the easiest proteins to cook, the quickest, but we're so intimidated by it. But what we recommend is at least 2 times a week to get a good serving of seafood. That could be in the form of a fish, baked, sauteed, broiled. It could be tuna as well. And so, yes, I'm always wanting to encourage families to eat more fish, not just during Lent. And we certainly don't want to fry.
Oh, yeah, of course. I'm always hearing that. I always get the parent, and I tell them to eat their more fish, and then the kids are like, fish sticks. And I'm like, no, that's not what I'm talking about.
Yeah, and so, if that's something the family is finding that their child will eat fish sticks, we love to give them ideas on how to create that, right? Because, again, baking, broiling, we've got a lot of really great ways to cook that flavor that we like and we're used to, the crunchiness from fried foods. There are ways to do that still and not making sure that you're adding all those extra fat calories from frying food. But it also we want to make sure that you're not destroying those really good healthy fats that are in that fish. And so there's a lot of reasons why we don't want to do that. But again, one of the things I always do is take it back to, well, what are we eating today? Are we making tacos asadas? Are we making, arroz con pollo? Well, how can we transition those proteins using something like a cod? How can we put those into your recipes? How can we start making fish tacos with a great slaw or even a nice chopped salad and a fruit cup with that, queso fresco and avocado? Really trying to paint a picture and giving them ideas on how to incorporate these, because what we know is we can't just say you need to eat this. We need to say you can eat this in the way that you know and love your foods, and this is how you do it.
Yeah.
So that's the piece that we hope to help families with, is really helping them understand that, we're telling you that this food is good for you and that your family needs it, but this is how you can do it, and I promise you everybody's going to love it. It might take a little bit of while and then in some steps, but exposure and leading by example is going to be the way to do it.
And then I also, of course I have a lot of kids that have excessive weight, but there's a decent number of kids that are underweight too. And so helping out these kids is a lot of times even more of a struggle than helping out the overweight kids, because we're dealing with them, it's a lot of the same problems, just they're drinking too much milk a lot of times, or they're drinking too much juice and not getting in the healthy calories that they need. And counseling them on healthy fats and proteins to eat sometimes is difficult, because because telling a kid you need to gain weight, it's just not something that we have to say every day. And so just counseling these kids through those situations and that kind of stuff.
Yeah, what I find with our kiddos that are not gaining weight like we would like them to they usually are picky eaters,
yes.
right? They've got some sort of food aversions. It's either texture, it could be color, it could be combinations of foods, and so it's our job as a dietitian to try to figure out what's going on here with this aversion. Why is there such a limited food sources that they're getting in? And it's probably the most frustrating thing as a parent to feel like we're eating all these foods. All of we many times we see this. The mom comes in and the family comes in and they'll say, well, she's eating all her fruits and vegetables, but he doesn't. And then it's typically the kid that's not gaining the weight that they need to. So again, we have to realize that each person is so individual in their wants and their likes, in their perception. Right, and so trying to figure out what what is really going through that child's mind is really difficult, and again frustrating for mom and dad. But we do have some really unique ways in making sure that we're asking the right questions to these families. And what's so interesting, what I find out about these kiddos that come through our office, is if you have an outside person coming in and recommending something and then just building it up to be something glamorous and wonderful and delicious, they are going to try it. Mm-hmm. And that's happened over and over in my office. And so sometimes it just takes somebody from the outside to come in and talk and encourage that kiddo to do that. And especially if it's a mom who's been trying to do everything and anything under the sun to try to get them to eat stuff, there's other ways to try to encourage them to do that. So I speak as a mother of a picky child. I've got 3 kids myself, and again, I understand that frustration more than anybody. But at the end of the day, what helps me feel good is that I know that I'm leading by example and I'm offering these good foods, and I'm going to be patient for whenever he's ready to keep on expanding his palate. That's the way I look at it, is really just making sure that you have exposure and understanding that this is going to take some time for them to really accept this flavor, but I'm going to keep on trying until it gets there.
Definitely. And do you ever talk about supplementation with vitamins and that kind of thing? Because I am very adamant that everyone needs vitamin D. I check everybody for vitamin D. I'm supplementing vitamin D all the time. And then, of course, in our 1 and 2-year-olds, we're checking for anemia and then supplementing iron. And so I am not so much about supplementing any other vitamins unless I see that there's a deficiency, but those are the 2 that I find so important that we need to supplement. Mm-hmm. And I was wondering what your thoughts on more supplementation.
Yeah, absolutely. Usually kiddos that are coming through are lacking on some form or fashion of mineral and vitamin because of lack of fruits, vegetables, and whole grains that they're not consuming on a daily. So we do have that conversation, and we do encourage it when it's warranted, especially for our picky eaters, that we know it's going to take months to even build in another vegetable that they may like. So yes, we do encourage that. With the vitamin D, it just depends also. If they're doing dairy, then we encourage making sure that it does have a little bit of fat in it. If we can control the other calories on the plates, because we know that vitamin D is a fat-soluble vitamin, and so that needs to be present in order to absorb it. We just look at the whole family's activities as a whole too. Are they going on a daily walk? Are they getting any type of sun? So that assessment piece becomes really important to us to figure out what they really need in terms of those mineral vitamins. But again, if a kiddo's coming in again with high cholesterol, or, you alluded to earlier, not having sufficient enough of HDLs, there is already a lack of mineral vitamins not coming in. So absolutely covering all those bases with a multivitamin is going to be very helpful. But one of our mantras as dietitians is we say food first, right?
Definitely.
Food first always, but we understand the need for some of those things that are not going to be coming through, or it's going to take a little bit of a time to get that transition into liking some of those foods too. So absolutely need those foods. And I recommend it even for other nutrients, even for adults that we know are not getting plenty enough of it from foods. But as the doctor, you see all of the labs that come through, is the prevalence of folks not getting enough vitamin D.
Oh, it's an epidemic in this country, I feel like. And I hate to bring it back to COVID, but I do feel that it is important to really make it clear that they have shown through many studies that the coronavirus is going to be less of a problem if you have supplemented with vitamin D, and you're less likely to catch it, you're less likely to be hospitalized from it. And so it's made me even more find that it's more important to really make sure that these kids have high enough levels. And then as far as picky eaters go, I think that the introduction of foods in infancy is a really important step in making sure that your kids are less likely to be picky eaters. Do you have any steps that you walk parents through in like the introduction of foods during that time?
Yeah, and typically we like to make sure they're introduced to vegetables before fruits so that they, again, the palate and recognizing those mineral vitamin flavors, if they can come early on, they're not going to be such an aversion when you get older. And so vegetables first, then fruits. One of my favorite foods to recommend as a first food is avocado.
Oh, same here. I always am recommending avocado as a first food.
Avocado is one of those ones where, yes, we talk about portioning because of it being a fat, but just the nutrition that you find in the growing minds of our kiddos can really benefit from that. And then bringing in those fruits after you've got a good solid 2 to 3 vegetables that they're accepting, that they're enjoying. Just again to build that palate in a different way. If you lead with sweet, it'll always be something that they prefer. Doesn't mean that they won't like vegetables. It does create a preference, in my opinion. But then again, you can have those ones that you do expose them to all those different flavors, and you're still going to have that aversion, those kids that have an aversion to, but every kid is so different.
For sure.
Yeah.
And then I always talk about food allergies, because that's been a lot of studies that's come out recently, and about introducing allergenic foods early on when we're talking to kids. So introducing the peanut butter, introducing the shrimp, introducing the milk. You know, most kids are getting milk through formula, or if mom's breastfeeding, there's usually some milk protein, but just making sure that they are introduced to all of those foods early on when we're starting off food. So that's part of my counseling that I always talk about.
Yeah, absolutely. And that's always been a confusing piece, I think.
Definitely. And that's why I wanted to clarify it, because so many parents have been told over the past 10 years, oh, you want to delay introduction of allergens. But with the trials coming out over the past few years, now we know that we need to introduce these allergens early. So I think it's a really good point to bring up that we need to start doing that and start talking to parents about introducing the foods early on.
Right. You know, our top allergens, fish, like you mentioned, or seafood, also peanuts. All those are really important, and nutritious foods. They do hold some nutrition in them, and so right on point with you, Dr. Maupin. Yes, introduce those. Don't wait so long. We want that exposure just so that we can make sure that child doesn't have, a reaction to begin. But we build also that tolerance too. Right. If would there be any kind of case or even a mild case. But absolutely, we do fall in line with that as well. I'm not sure, and I guess maybe doing a little research, I'm not sure where that came from, is to delay.
That was actually a recommendation from the American Academy of Pediatrics, because there was, the American Academy of Pediatrics sometimes lags a little bit behind science, and so that was actually a recommendation put forward. It was even, I think it may have even been in the 90s. It was a long time ago that recommendation was put in place. And so with the LEAP trial that came out about 5 years ago or so, where they started introducing peanuts to these eczematous kids and seeing how they did, that's what really changed the tides and made us go, okay, we need to start introducing these allergens early. But it wasn't really the introduction to delay. It wasn't really based in science. It was just people being concerned and cautious, and they thought that was the best tactic. But now we found that it's exactly the opposite.
Yeah. And I'm so glad you talk about that. It's so important.
Yeah, for sure.
Yeah, I love all the things that you're doing, Dr. Maupin, and the way you're talking to your patients on nutrition. I just definitely want to make sure that providers as yourself know that we are here to help also as a resource, because we know you don't have all the time to talk through everything, and so we want to be able to help you, and we've always so thankful to the South Alamo Medical Group for the partnership that we already have. we know that it makes a difference to be able to provide this coordinated care to patients. And so I just want to thank you for making nutrition really important in the patient's lives.
Oh, well, thank you. And I do, as much as I can, try and refer over to you guys. Sometimes I'm referring, to bariatric clinic or something, depends on what their labs show. But if it's more of a problem that I feel like can be addressed solely by a dietitian, then I'm going to refer over to you guys.
Yes, and so we appreciate that. We appreciate that, and we want to make sure that the community knows too that if they're not, if they're not being sent or they don't know, if their doctors didn't say, well, you need to go see a dietitian, but they want to learn more, we're also here for them as a resource as well. And so, your health begins with what you eat.
Definitely.
And in some cases, your health begins with what you're not eating, so we got to start eating them, right? So we love to pull those instances out. So just thank you so much for bringing all these really important topics to light.
Oh, well, thank you so much too, and I really appreciate your information. I learned something today, so I really appreciate that. And I hope that we'll continue our partnership and move forward and make sure that we keep all the kids in San Antonio healthy.
That is the goal.
Yes, thank you.
Thank you very much.
Thank you so much for coming to our talk and listening to us. We are with South Alamo Medical Group, which is now part of WellMed, and you can always call our offices 210-222-0333. I'm with Pediatrics. I'm at Barlight 201 here in South San Antonio, and if you would give us your information.
Yes, thank you for listening in today, and if you'd like to get a hold of H-E-B Nutrition Services, we can be reached at 855-481-1149 or also on heb.com/nutrition.